idea. It is not a very complicated kind of lectures. It's a brief idea as a you can say general physician or any specialized physician. How you are going to see the abdomen of a patient, you palpate abdomen, you find out that the liver is enlarged or not, whether spleen is enlarged or not. The patient comes to you with a pain abdomen or any abdominal bloating, then how do you see them and what you normally think that you should be concentrating on? And we as a radiologist, what do we do? Normally we divide this abdomen in different parts. You can say here 9 different parts we divide in. That means when you speak to your colleague, a friend of yours who is a doctor, oh, do you know this patient is having pain in a right hypochondria, or left hypochondria, or right lumbar, or left lumbar, or left iliac fossa, or right iliac fossa, or epigastric, umbilical, or hypogastric. So this is a common language that you will be using and for communicating with your fellow colleagues, fellow doctors. Normally you do not say the same thing to the patient. And you say that, oh, I saw a mass in the region of the epigastrium, things like that, So that's the reason I think why you should have a common language and how you can express yourself and by communicating yourself to the another fellow colleague of yours. And at the same time, and you should write a note down the findings in the chart of a patient. So when you write a note in a chart of a patient, then you will say, I found a mass in the epigastrium of the patient. Okay, this is the way the abdomen routinely everywhere is divided. As such, when you see the abdomen, it is like a magic box, as I told you in one of the lecture that it is like a sleeping tiger, because it contains multiple organs. You do not know when the patient comes to pain abdomen, which organ is abnormal. It's very, very difficult. Even the experienced I think clinician fumbles at times. They only come to know the diagnosis when patient is open up in our OR. So that's the reason abdomen is one of the very dice area of the abdomen of the human body. Unlike head, neck, or chest, I think abdomen is very crucial. So you should be very careful in giving diagnosis of the abdomen. So how the abdomen X-ray is done? This is the way abdomen X-ray is carried out. Here you can see here, this is the X-ray beam, and patient lies down safe, supine position, and X-ray is taken like this way. And here you get a quality of X-ray like this. And here, by seeing at the pelvis, you can know this is a female pelvis, this is a roundish, and it is a triradiate pelvis or it is a male pelvis. This is the way you distinguish between male and female patient. One of the important things that you see in the abdomen is the bones. Can you see the bones? Yeah, these are the bones. So you should not ignore, because bone can give you significant important findings. And these are the ribs here, and followed by transverse processes, followed by pelvis here. Okay? The many times, whenever there's a problem with the kidneys, and you should look the transverse processes, because most of the stone in the ureter lying in the line of the transverse processes. So these are very important. At the same time, you should look for the consistency of the bone, how the bones are. Is it normal or abnormal? Here you can see your bones are normal here in this. Here they are very uniform. The texture is very good. But here, the texture is quite bizarre. Can you see that? This area, abnormal. This area is normal. Here, this area is abnormal. A lot of stuff sitting over here, the dark or whitish kind of thing. So these are called metastases. This patient had prostate carcinoma. Whenever there is a prostate cancer, the patient can have metastasis in the bone, and these metastases can look whitish like this. Okay? This is a cartoon showing how the metastasis distribution is there. So apparently, whenever you see an abdomen X-ray, you should always concentrate on bone. Is it going to give you any clue why the patient is suffering or why the patient has come to you? Now, apart from bone, one of the important structure you should look forward for is the diaphragm. These are two diaphragms here. This is a right dome and this is a left dome. Normally, right dome is higher compared to left dome, almost by 2 centimeter to 2.5 centimeter. And if you find the margins are smooth, nothing is underneath, then it is fine. And at the same time, you should see the claustrophonic angle here. Okay? This angle should be very sharp. Whenever this angle is obliterated, that means there is a fluid there. This patient has got pleural effusion. There is one diagnosis called pleurisy. Patient comes with right hypochondriac pain, severe pain. And the pain increases with deep breath in and out. In situation like this, you have to tell see this area, is it there anything, or is it normal or abnormal? When this is obliterated, that means this patient has been pleural effusion. Now here, it's a very bizarre case here. This is a perforation where abdominal X-ray was taken. What you can see free gas here. Unlike this diaphragm, you can see here, very smooth, nothing is seen underneath. Whereas here, what you could see here, a lot of air, and the dome of the diaphragm has been lifted up in both sides. When there is a perforation of the abdomen, either colon or duodenum or stomach or any perforated injury, in those situations, always there will be air underneath. Okay? So when you see things like this, and this is something very, very serious, because patient can develop peritonitis, and if you do not get treatment, within 48 hours, patient can die because of severe infection and septicemia. So this is one of the very serious findings, and you should look for. And at the same time, in your exam, you can expect a picture like this. And what is this? So you should say it is a perforation of the viscus and there is air under the dome of diaphragm. Okay? Now, as I said, the abdomen contains multiple organs. Do you know? And one of the largest organ in abdomen is liver. Okay? Liver is a triangular structure like this way. And here you can see there, this is hepatic vein, and this is the portal vein, and this is the inferior vena cava, and here is the aorta behind. And here, this is, absolutely, you guys are smart. And here is a lung here, this is the abdomen here, and liver, here is the stomach, large gut, small gut, right? You can say multiple organs. Now how do you see the abdomen? The abdomen X-ray, you see the liver is a triangular structure like this way. And this is very clearly seen because of pro-peritoneal fat line. Fat looks lucent in an X-ray. That's why it sharpens the margin of the liver here. And in this cartoon also shows this same location where the liver is located. Okay? These clips are because of the operation patient had undergone because of the removal of the gallbladder. That means cholecystectomy. Okay? Now here, what is happening here? This is the liver here, no doubt. And what are these loops? These are bowel loops. Absolutely right. These are large gut loops and small gut loops. They are pushed down by the enlarged liver. Here, liver is slightly enlarged compared to the previous case. So whenever there is an enlargement of the liver, it will push the bowel loops below. And here, you can see a glimpse of the spleen here. Okay? Now, apart from that, another important structure you should concentrate on. Can you see these oblique lines, these lines? Yes. You guys are smart, really. So this is psoas muscle, you know. Why psoas muscle is important? I beg your pardon? Nerves. Nerves. No, nerves are everywhere in the body, you know. Nerve particles are everywhere, or you can say nerve radicals are everywhere in the body. But psoas is important point of view, you know. Whenever there is a pain abdomen, suppose patient coming with renal stone here, in the left side, there will be scoliosis, you know. The spine would be curved, scoliosis, would be concavity toward this side. Why? Because when there is a pain here, this muscle contracts. When this muscle contracts and it curves the bone, or you can say the thoracolumbar spine, number one. Secondly, whenever there is an inflammation of the psoas muscle, this margin will be gone. you cannot see the margin like this. Whenever there is infiltration by tumor, like lymphoma, like tuberculosis, which affects the psoas muscle, you will not find this thin line. It will be fuzzy, it will be ill-defined. So psoas tells you many of the findings in the abdomen when patient comes to you with plain or you can say pain abdomen. And as I said, a nerve, sometimes a neurogenic tumor, they can also arise on any of these areas because there's a large bundle of, you can say neural bundles are here, sympathetic and parasympathetic. So those things, any tumor arising from here, the psoas would be enlarged. Now let's move to the GI tract. What is GI tract? Gastrointestinal tract. Okay. How do you see that? Normally what do you do? Whenever you go to the ward, you will see people are fed with a nasogastric tube. Nasogastric tube is done for various purposes. Number one, for diagnosis. Number two, for feeding. Okay. So how do you use for diagnosis? When you put a tube like this way, the tube takes a curve like this. Why? This is esophagus. Yes, this is esophagus. This is gastroesophageal junction. This is the body of the stomach, and this is the entract of the stomach. That's why it takes a shape like that automatically. Okay. Now here, the plain X-ray abdomen showing the stomach. Okay. But obviously, I will not expect you to identify all the parts of stomach here, but it will be very difficult, because you are just a beginner. And how you identify the stomach? You ask the patient to swallow barium. It's called barium sulfate. This is a radio-opaque substance. Okay. Whenever she swallows, and the barium flows down up to the upper GI tract, lower GI tract. Okay. How it happens? When swallows, this is esophagus here. You can see here beautifully the filling of the esophagus. Whether the esophagus is filled normally or not, you will come to know. If there is a narrowing, you will come to know. And this is a double contrast image to show the quality of status of the mucosa of the esophagus. Right? Here, just to see the lumen, where it is standing or not, and here to see mucosa, where is there any esophagitis or any tumor is sitting over in the wall of the esophagus. All these findings can be diagnosed by barium swallow. As you go further down, when the barium trickles down to the stomach, and it looks like this. Okay? Here you can see this is the fundus of the stomach, this is the body of the stomach, this is the antrum, a duodenum, first, second, third, and fourth part. Okay? These crisscross lines are called rugae. Okay? These are called rugae. Here you can see the rugae of the stomach. Normally these are very, very fine. Whenever you find irregularities, solid looking, or you can say thick, more than 1 centimeter, then you will say these are thickened. These are thickened. So maybe patient is having tumor, patient is having lymphoma, or patient is having gastritis, atrophic gastritis. On the other way, this would be more of a like this, without any, rugae. Rugae would be getting bald here. Now when the contrast further goes down, what happens? Slowly duodenum fills up, then small bowel fills up here. This is small bowel. Okay? So now, as we go further, it gives a woolly appearance. Small bowel looks very crisscross, fine woolly appearance here. And these are because of valvulical emantis. You can see here, it is a distribution, all are due to small bowel filling. Normally, small bowel is very difficult to diagnose because it is hidden inside the abdomen. Now, as you further follow it up, the contrast will slowly follow within 1.5 hours or so to the colon area. This is the area of the colon, right? As you can see here, small bowel is much more delayed. You can see here it's written 20 minutes is written, some patient 1.5 hours. The contrast will flow down and go into the large bowel. This is the ileocecal valve. From there, ascending colon, transverse colon, and descending colon, and rectum is filled up. Right? This is the way the barium can identify the different parts of the abdominal organs.